Blood pressure. Gather the necessary equipment. Position the client comfortably on chair with arms rested alongside his body. Look for client's radial artery and palpate for the palpatory pulse. Position the cuff 2 inches above the antecubital fossa. Position the sphygmomanometer so that the measuring scan is turned away from the client's line of vision and the mercury column vertical. Place the stethoscope disc over the brachial artery to ensure good amplification of sounds for accurate reading. With the stethoscope in position, inflate the cuff until the pressure rises to approximately 20 to 30 millimeters above the anticipated systolic pressure. Release the air in the cuff slowly while noting the reading on the manometer. Note the first clear and strong sound as the systolic reading and the last audible sound as the diastolic reading. Respiratory rate. Note the rise and fall of the patient's chest with each inspiration and expiration. Observation can be made without disturbing the client's clothes. Using a watch with a second hand, count the number of respiration for 1 minute. If the respiration is abnormal, repeat the count in order to determine accurately the rate and characteristics. Pulse rate. Press client's wrist with the thumb at the back of the wrist and the first 2 fingers over the radial artery with moderate pressure. Count for the number of pulsations for 1 full minute. Observe for the rise and fall of the client's chest while fingers are still on the client's radial artery after counting the pulse rate. Inform the client about the results and its significance. Temperature. Clean the thermometer with antiseptic solution from the bulb towards the stem in a circular motion. Place the thermometer to the client's axilla. Hold the thermometer in place in 2 to 3 minutes or until you hear the beep sound. Remove the thermometer from client's axilla and note the reading. Inform the client about the results and its significance. Disinfect the thermometer with an antiseptic solution from the stem going towards the bulb in a circular motion. Write all findings in SOAP form.
When assessing vital signs on an infant, you want to start with the most non-invasive vital signs first, while the infant is calm and resting. Therefore, first you're going to check the respirations, followed by the heart rate, then the temperature, the weight, the length, the head circumference, and then the chest circumference. Before you assess the infant's vital signs, you want to make sure that you gather your supplies. So what you're going to need is an infant-sized stethoscope, followed by a measuring tape, a thermometer, a scale, and a watch to count with. And you'll want to make sure that you sanitize everything that you're going to use on that infant before and after use, and of course perform hand hygiene before beginning. First, we're going to check respirations, and we're going to do that first while the infant is laying here nice and calm so we get an accurate reading. And a normal respiratory rate in an infant is about 30 to 60 breaths per minute. So before we even start counting respirations, we want to look at that infant and we want to make sure that they're not in any respiratory distress. So one way we can tell is we can look at the nose. Infants love to breathe through their nose. So we're checking their nostrils and we're looking for nasal flaring. And if you see that, that's not a good sign. Also, you want to look at that chest and you want to look for anything like chest retractions. And what that looks like, it literally looks like the skin has just been pulled over the ribs and you can see the ribs very well. And this infant does not have either of those things. In addition, you want to look at the infant's skin color and make sure it's appropriate for their skin tone and that you don't see any signs and symptoms of cyanosis. So to count respirations, what we're going to do is we're going to count for 1 full minute, the rise and the fall of the chest. Now, with an adult, you probably remember that if the rate was regular, we could count for 30 seconds and multiply by 2. Well, this isn't the case with the infant. You're going to do it for 1 full minute because infants' breathing pattern is irregular. They have what's called periodic breathing where they'll breathe and then they'll stop for a second. So we're going to count for 1 full minute and we're looking at that rise and that fall of the chest. And infants like to breathe abdominally, so if you're having trouble, what you could do is you could lightly place your hand on the chest and feel the rise and the fall. But you want to be careful not to disturb the infant and get them crying. So I'll demonstrate and I'll count with each rise and with each fall just to give you an example. So here we go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So you want to count that rise and that fall for 1 full minute and then document that number. So his respirations were 38, which again is normal because a normal rate is about 30 to 60 breaths per minute. To count the heart rate, you want to make sure that you're using the appropriate size diaphragm and bell, and we have an infant here, so we're using an infant size. And for an infant who is less than a month, a normal heart rate is about 100 to 190 beats per minute. And this can vary if the infant is crying or if they're sleeping. Now, if the infant is over 1 month, that heart rate goes down a little bit, the normal ranges, and it's about 90 to 180 beats per minute. So to count the heart rate, what we're going to do is we're going to use the apical pulse. We're not going to use the radial pulse like how we do in adults. So to find the apical pulse, what you want to do is you want to find the 4th intercostal space. Now, in an adult, remember it was the 5th intercostal space at the midclavicular line, but for an infant, it's at the 4th intercostal space lateral to the midclavicular line. So you want to find the clavicle, and then we have the breastbone. And we're going to go down and we're going to fill in between those little ribs, and we're going to go to the 4th space. So there's 1, 2, 3, 4, and then we're going to just go lateral to the midclavicular line. So we're going to go about right here, and this is about where the apical pulse is on our infant. And we're going to place our stethoscope there, and we're going to listen for 1 full minute. Now, an infant's heart rate can have sinus arrhythmia, where it's irregular because their heart rate can be affected with the respirations, where their heart rate will actually speed up and slow down with respiration. So that's why you want to count for 1 full minute. Now, counting an infant's heart rate can be difficult because it is fast. And one thing that I have found that definitely helps me is I find that heart rate and then I tap my finger along with that heart rate and count. And our infant's heart rate here is about 142. To check the temperature in the infant, we're going to check it via the axillary route. So we're going to place the thermometer tip in the armpit of the infant. And I've already placed the little protective sheath over the thermometer. So a normal temperature in an infant can vary anywhere between 97.5 to 99.3 degrees Fahrenheit. To take the temperature, make sure that you turn the thermometer on, and then you're going to place the tip of the thermometer deep inside the fold of the armpit, and then you're just going to put the arm down, and you're going to wait for the thermometer to beep to tell you the reading. Okay, our thermometer is beeping, so it is done, and the reading is 99.1. So we would document this, and this falls within normal range. To obtain a weight on an infant, you want to remove the infant's clothing and any soiled diaper. A dry diaper can be used. So place the infant on the scale and obtain the weight. Here, this infant weighs 10 pounds, 2 ounces. So you'd want to document that weight and then look at the infant's previous weights. This patient weighed 8 pounds at birth, and now at this 2-week appointment, they weigh 10 pounds, 2 ounces. So that is a very good weight gain from their birth weight. To measure length, what you want to do is you want to lay the baby on a surface that you can mark. You'll need a pin for this, and you may need someone's help to help you measure the baby, because you're going to measure from head to heel. So lay the baby back. You'll want to put their head midline like this, and then just mark their head. Then you want to take the leg and extend it outward like this. Make sure it's nice and extended. You may have to work with them a little bit. And then mark it at the heel. And a normal length in an infant is about 18 to 22 inches. And then we're going to gently lift the baby up. So we're going to measure this, and we're actually measuring this in inches, and the infant is 22 inches. To measure head circumference, you're going to need a measuring tape, and you want one that measures in centimeters. Now, a normal head circumference in an infant is about 33 to 38 centimeters. And what we want to do is we want to place the tape measure around the largest diameter of the head. So to do that, we're going to place it a little bit above the eyebrows, and then we're going to wrap that around and place it around the most prominent part at the back of the head. So let's do that. So gently just lift the head up and put the measuring tape behind it. And then pull your measuring tape around, move his head a little bit. And let's see what we get. And his head circumference is about 37 centimeters. To measure chest circumference, you want to get your measuring tape. Again, you'll be measuring this in centimeters. And you're going to take it and use the nipple line as your guide. So you're going to wrap it around there and then measure it. And his is about 36, and this should be about 1 to 2 centimeters less than what the head circumference was.
Assessing vital signs of an infant, you start with the most non-invasive vital sign first, while the infant is calm and resting. Therefore, we're going to check the respiration, the heart rate, temperature, weight, length, head circumference, and the chest circumference. Before we begin, make sure you gather all your supplies. So what you are going to need is an infant-sized stethoscope, measuring tape, temperature, scale, and a watch. Make sure you sanitize everything that you will use before and after. And of course, wash your hands. Now, let's start. First, we're going to check the respiratory. We're going to do that first while the infant is lying here nice and calm. So we get an accurate reading. And the normal respiratory rate of an infant is about 30 to 60 beats per minute. You already take off all the clothes of the baby. Before we counting respiratory, we want to look at the baby. We want to make sure that there's no any respiratory distress. So one way we can tell that is we look at the nose. Infant love to breathe through their nose. So we were checking their nostrils. We're looking for the nasal flaring. If you see that, it's not a good sign. And you look at the chest. If there's any like chest retraction, it literally looks like the skin has just been full over the ribs, and you can see the ribs very well. And this infant does not have either of these things. To count the respiration, what we're going to do is we're going to count 1 full minute, the rise and fall of the chest. Infant breathing pattern is irregular. Infant like to breathe abdominally, so if you're having trouble, just lightly place your hand in the chest and feel the rise and fall. But be careful not to disturb the infant and get them crying. Let's do it. So we will try to count the respiration of the baby. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. You count the rise and fall for 1 minute, so the infant's respiration is 38, which means it's normal because the normal rate is 30 to 60 breaths per minute. Now, we're going to get the heart rate of the infant. So, we're gonna use an infant-sized stethoscope. An infant who is less than a month, a normal heart rate is about 100 to 190 beats per minute. This can vary in the infant if it's crying or sleeping. If the infant is over 1 month, the heart rate goes down a little bit, but a normal rate is about 90 to 80 beats per minute. To count the heart rate, we are going to do is use the apical pulse, not going to use the radial pulse. Apical pulse located here in this area. Here's the apical pulse. We're going to place the stethoscope here. We're going to listen for 1 full minute. Our infant heart rate is 142, which is normal because the normal rate is 100 to 190 beats per minute. To check the temperature in the infant, we're going to check via auxiliary route. We're going to place a thermometer in the infant armpit. So we're going to use digital thermometer. A normal temperature of an infant is vary anywhere between 97.5 to 99.3 degree Fahrenheit. To take the temperature, make sure to turn on the temperature. Place the temperature deep inside the armpit and then put the arm down and wait the temperature to dip. So we're going to put, see? Wait the temperature to beep to get the reading. When it's beep, it's done. The reading is 99.1 degree Fahrenheit. The baby have normal temperature. So we will document it. To obtain the infant weight, we remove the infant clothing and sold diaper. But dry diapers can be used. And now, we will weight the baby. And then, let's assume that this is the weight scale of the baby. Place the infant in the scale and obtain the weight. The infant weight is 10 pounds and 2 ounces. So, we will document it. To measure the length, lay the infant on the surface that you can mark. You need a marker or any pen. You find it difficult because the baby is moving. Ask for help. We're going to measure from head to heel. And just mark here in the head. Then to take the leg, extend outward like this. A normal length of an infant is about 18 to 22 inches. Where am I? After marking, gently lift the baby up. And then we will measure the line using an inches here. So this is the one that we mark from head to heel. So let's assume that let's assume the result of the length of the infant is 22 inches from head to heel. To measure head circumference, we're going to need a measuring tape. Measuring in centimeters, a normal head circumference in an infant is about 33 to 38 centimeters. We're going to place the tape measure around the largest diameter of the head. To do that, we're going to place a little bit above the eyebrows. Then we're going to wrap that around and place it around the most prominent part of the head. So gently lift the head and put the measuring tape behind. Pull the measuring tape around his head. The head circumference of the infant is about 33 centimeters. Now get the chest circumference of the infant. So again, get your measuring tapes. We will measuring this in centimeter. You're going to take it and use the nipple line. So nipple line as your guide. Wrap it up around. Gently lift the baby. So wrap it around, and then his chest circumference is 32 centimeters. The chest circumference of the normal baby and the true baby is around 36 centimeters. Now we are done.
Vital signs we will be taking today are body temperature, respiratory rate, heart rate, and blood pressure. We are performing this demo during COVID-19 pandemic, therefore we need to perform proper hand hygiene and use of face masks. To properly wear a mask, perform hand hygiene, inspect for any holes, tears, or damage. Always use a fresh mask and one that has the right size. Respirator mask. Hold in one hand with the strings hanging below. Place over your nose, mouth, and chin. Place the straps over the head. Avoid tangling and overlapping. Ensure proper fit and do a seal test to ensure it does not leak air. Medical or surgical mask. Hold the straps on both ends and carefully place over your nose, mouth, and chin. Ensure proper fit. Fabric mask. Hold the straps on both ends and carefully place over your nose, mouth, and chin. Ensure proper fit. To properly remove a mask, perform hand hygiene. Make sure you don't touch the front of the mask because it is contaminated. Use the straps to remove. Dispose one-time use masks, preferably in a closed bin, and place fabric masks in a separate soiled laundry hamper. Now we are ready to perform the skills for pediatric vital signs. Approach the toddler and introduce yourself. Make sure the child is rested. If she was active before the procedure, give a few minutes rest. Let her know that you will be taking the vital signs to make sure her body is healthy. Avoid using terminologies which a toddler will not understand. Some children may refuse to cooperate. Give her time to settle down, explain in a friendly way, and let her investigate your materials for as long as it is safe. This usually eases the child and soon she will let you perform the skill. While some children may be difficult, some are easier to manage and are happy to cooperate. Body temperature can be obtained using a thermometer through the armpit, ear, mouth, anus, or skin using a special thermometer. Today, we will use the armpit. Place the tip of the thermometer gently in the armpit. The beep will indicate the reading is done. Check and record the temperature. Respiration rate can be observed discreetly while temperature is being taken. Telling the child her breathing is being observed usually makes the child uneasy and change breathing pattern. Observe the rise and fall of the shoulders or the chest for 1 full minute. Heart rate can be taken in the body's 9 pulse points. Today, we will observe the apical pulse. The rate, strength, and rhythm are usually observed. Count the number of beats for 1 full minute. Blood pressure. Use the pediatric size cuffs and stethoscopes for children because using the wrong size can harm the child and give wrong reading. 2 numbers are recorded when measuring the BP. The systolic pressure, which is the higher number referring to the pressure in the artery when the heart contracts and pumps blood, and the diastolic pressure, which is the lower number referring to the pressure inside the artery when the heart is at rest and is filling blood. Both numbers are recorded as mmHg or millimeters of mercury. Now that all 4 data are taken, remember to thank your patient for letting you take her vital signs. Give small rewards if possible so that she will not be afraid of doctors and medical staffs anymore. Discuss the data you collected on your chart with the parent or the guardian. Make sure you inform what is the normal range and what is obtained from the child to give knowledge on the child's vital sign. Doctor's attention may need to be called for some concerns. Do not forget to clean your apparatus before and after taking the vital signs, and also perform hand hygiene after touching the patient and the patient's surroundings.
Vital sign. Vital signs are measurements that help in tracking a human body basic function. They usually serve as the first step of every medical evaluation or examination. They help medical professionals detect the presence of any underlying condition that could be affecting a patient's health. There are 5 main vital signs: body temperature, pulse, heart rate, blood pressure, oxygen saturation, respiratory breathing rate. To get the vital signs, these are the materials needed: digital sphygmomanometer, oximeter, digital thermometer, alcohol, cotton balls, and gloves. How to use digital sphygmomanometer. Our objective to learn how to get blood pressure using digital sphygmomanometer. It consists of an electronic sensor to measure the blood pressure and the reading or display on the digital monitor. This is the blood pressure chart by age. To get the blood pressure of the patient, you need to check the profile of the patient. Ask the patient when the last time she took her blood pressure was and what the result was. To get the blood pressure of the patient using the automatic blood pressure monitor, sit comfortable place with good back support at the table. Place the cuff on the bare upper arm 1 inch above the bend of the elbow. Make sure the tubing falls over the front center of the arm so that the sensor is correctly placed. Pull the end of the cuff so that it's evenly tight around the arm. You should place it tight enough so that you can only slip 2 fingertips under the top edge of the cuff. Make sure the skin doesn't pinch when the cuff inflates. To get started, wait a moment, then press start. Remain still and quiet as the machine begins measuring. The cuff will inflate, then slowly deflate so that the machine can take your measurement. When the reading is complete, the monitor displays your blood pressure and pulse on the digital panel. Blood pressure is a measure of the force of the blood against the wall of the blood vessels. They are the tubes that carry blood throughout the body. Blood pressure is written as 2 numbers: the systolic blood pressure and the diastolic blood pressure. The result of the blood pressure of our patient is 121/77 and the pulse rate is 82 beats per minute. Remove the cuff and do the aftercare. Remove your gloves and wash your hands properly. Don't forget to do your documentation. How to use digital thermometer. Our objective is to learn how to get temperature using digital thermometer. Here's the average body temperature based on age of the patient. Digital thermometer can be used to record temperature from the mouth, armpit, rectum, and forehead. We're going to use infrared temperature. It measures the temperature of a subject from a distance. You need to hold the temperature perpendicular to the subject forehead at manufacturer recommended distance. Make sure you hold the device directly perpendicular to the forehead. Press the power button and wait till you get the result. Don't forget to take note the patient's temperature. When using digital thermometer, you will be needing an alcohol and a cotton balls to disinfect the thermometer from the bottom to stem or from the cleanliest to dirtiest part of the thermometer. After disinfecting the thermometer, check the thermometer if it is on LO sign. Then put the thermometer inside the axilla of the patient. The thermometer will beep when your result is ready. Don't forget to take note the body temperature of the patient. Disinfect again the thermometer from the stem to bulb, aka the process in reverse from the first disinfection, starting from the cleanest to dirtiest. Do your aftercare, remove your gloves, and wash your hands properly. And don't forget to do your documentation. How to use oximeter. Objective: to learn how to get pulse rate using oximeter. These are the normal blood oxygen levels. Find a comfortable position and rest for at least 5 minutes before taking reading. Place the oximeter on the fingertip or either your index finger. It should feel snug but comfortable. Keep still for at least a minute. The pulse oximeter uses a cold light source that shines a light through the fingertip, making the tip appear to be red. By analyzing the light from the light source that passes through the finger, the device is able to determine the percentage of oxygen in the red blood cells. After you get the pulse rate, do your documentation. Do the aftercare, remove your gloves, and wash your hands properly.